everyone. My name is Emmitt Griffith. Today I'm going to be giving a speech on sickle cell anemia. In my audience, I have my wife Nicole, my dog Nella, and my son Emmitt. Does anyone in the audience know what sickle cell anemia is? Sickle cell anemia is a hereditary blood disease that are passed by genes from parents to their children. Today, I look forward to sharing information on this topic with you all. Sickle cell anemia is not contagious. A person cannot catch it like a cold or infection from someone else. There are many treatment options available for sickle cell anemia. Based on the symptoms, some of the treatment options include pain management, blood transfusions, IV fluids, and bone marrow transplants. Sickle cell anemia is a disease that is more common in certain ethnic groups. My goal today is to give you a better understanding what sickle cell anemia is by the end of this speech. According to the National Institute of Health, the term sickle cell disease or anemia describes a group of inherited red blood cells disorders. People with sickle cell anemia have abnormal hemoglobin called hemoglobin S or sickle hemoglobin in their red blood cells. People who have sickle cell anemia inherit two abnormal hemoglobin genes, one from each parent. This causes the red blood cells to be deformed in the shape of a sickle or half-moon shape, which prevents the blood from flowing properly and causes sickle cell crisis. Sickle cell crisis is a painful episode that happens when sickle-shaped red blood cells block blood vessels. Blood and oxygen cannot get to their tissue and it causes pain. The treatment for sickle cell anemia is treated as symptoms occur. Based on the symptoms, some of the treatment options include pain management, blood transfusions, IV fluids, and bone marrow transplants. The doctors treat the symptoms of sickle cell anemia as they occur. For example, if a person has blood clots, they will be treated with IV fluids to help break up the clots and reduce the blockage of red blood vessels. IV fluids will dilute the red blood cells, causing the clots to break up. This is a common treatment for people in sickle cell crisis. If a person with sickle cell anemia is in severe pain, the doctor will treat the pain with medications such as morphine. According to the Kaiser Foundation, hydroxyurea is one of the most common drugs used to prevent sickle cell crisis. Hydroxyurea decreases bone marrow function, an effect that may lead to a low number of red blood cells, white blood cells, and platelets, which in turn prevents the cells from clotting, which prevents sickle cell crisis. Bone marrow transplant is a treatment that may lead to a potential cure for sickle cell one day. A bone marrow transplant is a transplant that is most commonly given by a sibling or a family member with a match for blood cells. The patient is given a high dose of chemotherapy and radiation to the entire body to wipe out the bone marrow. At that point, the new bone marrow is given through an IV to the patient with sickle cell. If all goes well, the donor bone marrow cells repopulate the patient's bone marrow and start to make new healthy red blood cells, which cures the sickle cell disease. Now let's talk about who's at risk. Sickle cell anemia is a disease that is more common in certain ethnic groups, and it occurs at birth. The Center for Disease Control and Prevention reports that approximately 100,000 Americans are affected with sickle cell. Sickle cell occurs in about 1 out of every 365 African American births. and about 1 in 13 African American babies are born with the trait. It is also common in Hispanic Americans from Central and South America, and 1 out of every 16,000 Hispanic American births. Sickle cell also affects Middle Eastern people, Asians, and Indians, and people of Mediterranean descent. Today I share information and facts around sickle cell anemia. You learned what sickle cell anemia is, some of the treatment options, and who's at risk. Before I let you go, I would like to share one last fact with you around the lifespan of a person diagnosed with sickle cell anemia. It wasn't that long ago that most people with sickle cell anemia died in childhood. Or if you were lucky, you would live to be 20 years old. Now, through advancements in medicine and technology, the lifespan has increased to an estimated 60 years of age in males and 68 years of age in females. This information is from the National Center for Biotechnology Information. I chose the topic of sickle cell anemia because it affects people in my family, and it is an important disease that we all should be informed on. Thank you.